Today I'm here to talk about wound care management and what PTAs do to manage those wounds. But first, you need to know about normal wound care healing. So there's 3 ways that wounds heal. The first is through primary intention, and that's where the surgeon will bring the edges of the wound together, such as through stitches or staples and skin grafts. The second is
secondary intention.
That's where the wound is left to heal on its own through contraction or epithelialization. The third is tertiary intention, and that's a delayed primary closure. You also need to know and teach your patients signs of infection so they can seek immediate medical care. The first sign of infection is a change in drainage, color, amount, and then odor. The peri-wound area may become red or warm, then increased pain level, a change in the quality of granulation tissue, no measurable contraction in the wound in 2 to 4 weeks, and fever and loss of appetite. And then there's 9 characteristics of a wound that you should know and document for your soap notes. The first is the location, the size, the shape, edges, tunneling, undermining, and sinus tracts. The base, if it's red for granulation tissue, yellow for slough, and black for eschar, and you're going to use percentages for that. The peri-wound area, and you're going to note any edema or maceration, pain, and then the bacteria. And what do we as physical therapy assistants do for interventions? Well, there's cleaning, which we use the whirlpool, pulsatile lavage, and non-forceful irrigation. We also do debridement, which uses the pulsatile lavage and wet to dry dressings. Topical agents, such as acetic acid, which is vinegar. Mechanical modalities, such as ultrasound, e-stem, diathermy, UV radiation, hyperbaric O2 therapy, thermotherapy, wound vacs, and cold lasers. Dressings, which uses gauze, impregnated gauze, and new skin, and compression therapy. So before I begin to address Seymour's sacral wound, I'm going to show you the supplies that you need necessary. You're going to have some saline, you're going to have some saline soaked gauze, but also another one to place on top of the wound, so make sure you get enough of those. You're going to have to measure it for your documentation. So you can either use these circles and lay it on the wound, and it has millimeters that show the size of it, or you can use this ruler, which has the millimeters on this also. You're going to need some cotton-tipped applicators to address the tunneling if they have any, some tweezers, and some packing strips, and these are for the tunneling as well. You're going to need some scissors and tape. You can have a camera ready so you can take a picture of the wound for the shape. And you're going to need to be in sterile field, but since Seymour is not at any risk of catching an infection, I'm just going to have some clean gloves on. So why don't you come and take a closer look, and I'll show you how to pack and address Seymour's wounds. So this is Seymour, and I'm in sterile field right now. And you also want to make sure that your patient is covered as much as possible and only expose the area that you will need to have exposed. So first, we're going to go for the location, and it is on this patient's sacral area. Then you're going to go for the size. So you can use these circles, like I said before, and place it over. You're going to want to go with their body. You're going to want to place it in the center of the wound, and you can see that it's 5 millimeters right here. You're also going to want to record it as a clock, with this being 12, this being 6, 3, and 9. So for the 12 to 6, you have 55 millimeters. For the 3 to 9, you have 53 millimeters. For these, you might want to have an aid so you can have them record. You're also going to want to take note of the edges. If there's any blackness around it or any of that sort of stuff. Next, you're going to want to take these cotton-tipped applicators, and you're going to find any tunneling in here and put it in there, and you're going to want to pinch it off and hold it up. So then that's how deep that tunnel is. Then you will take the measuring tape and measure how long it is. So it's 25 millimeters. And you're going to want to address any of that throughout the wound. You're also going to want to take note of the base, and you can see that it's 50% granulation tissue and 50% slough. So as long as it doesn't get worse, then it's getting better. Next, you're going to, after you have cleaned the wound, which you would have used pulsatile lavage to clean out this wound, then you're going to get some packing strips right here. And you will take this and you'll cut off a small portion of it. And you're going to take it and put it inside this tunneling that you have. And you're going to want to press it down in there. But you're going to want to be gentle because it's not going to be very comfortable for the patient. So once you have all the tunneling filled in, you're going to take some of these saline soaked gauze . You could have had these pre-made already. Oh, also before you put these gauze in, you could have taken your camera and taken a picture for the shape. If it's an irregular shape, if it looks like Texas, you can write that it looks like Texas, but it's mostly going to be taking a picture and then putting it in their notes. So you're going to want these to pack it in there. And then you're going to take a dry one, place it over it, and then tape down the edges so no bacteria can get in. There you go. And that's Seymour. But make sure that everything's nice and secured. And that's it. Thanks for joining me.